Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Mrs. Smythe.
Hi.
I'm Dr. Gerstner. I'm a temporal-mandibular disorder specialist in the school, which means I know something about the joints and the muscles. And I hear you've got a condition where you can't open.
Yeah.
Can you tell me a little bit more about that?
For about 2 days, I haven't really been able to open my mouth more than what you see right now. So.
Did anything happen 2 days ago that set this off?
Maybe a little bit lack of sleep, but not anything really physical that I can think of that I've done.
And did it happen just all of a sudden, or has this been building for some time?
Periodically I'll have the popping, and I'll even get a lock, but I've always been able to manipulate it myself. This past week I've been having quite a bit of popping, and then when it locked, it really locked. I couldn't get it undone.
Yeah. That's the way they can be sometimes. So this week has been particularly stressful or different in some way?
I would say, yeah, a little more than usual.
Have you had the popping and clicking for an extended period of time?
A couple of weeks,
Just
I would say.
a couple of weeks. So before that, this has not been something you've had for maybe...
Just off and on. It seems like kind of a chronic situation for me, just this popping. Sometimes it hurts a little, a sharpness, but like I say, I've never had it, so if it locked, I've never had it that I couldn't undo it myself.
Okay. But now it's definitely locked, and obviously I can tell you can't open. Are you seeing a doctor or a dentist, or have you seen one previously for this condition?
No, I really haven't, because I've been able to do it myself. I mean, my old dentist knew I had clicking and popping, but I never had to have her actually manipulate it for me. I'm
interested in knowing how you say you manipulate it. I'm interested in knowing what you've been doing in the past.
I can't even do it now, but sometimes by swagging or shifting my jaw from side to side, even my hand movement a little bit, but usually just by making my lower jaw go over to the right, over to the left, back and forth. It'll be a sharp pain, and it'll go back into place.
Okay.
I can't even move it to the right. I can move it a little to the left, but I can't even, it's immobilized this side.
Yeah, okay. How long have your pain symptoms been with you? Have you had an extended history of that?
Do you mean just for this locking? It's been about 2 days that it's been locked.
Just 2 days? Okay. Can you do anything that makes your symptoms better in terms of improving either your opening or reducing the pain levels?
I can't.
Okay. Does anything make them worse, like stress in your life or other things?
It's just kind of a constant right now, a constant pain. And maybe the stress brought it on, but right now it's just a constant.
Did your previous dentist make any recommendations in terms of ice packs or heat packs, or have you tried those kind of things?
I have tried those. She had suggested that if I ever had that situation. But it's never been this severe before. I have used heat before. I don't know which way. I get confused, heat, cold, I don't know. But like I say, it's never lasted this long. I've always been able to correct it.
Let me just have a look at your jaw right now. Just bite together for me. And just open as wide as you possibly can. Okay, and that's it. And are you feeling a lot of pain with that? And where is that pain located?
Right, mostly here.
Right there. And if you try to stretch anymore, does the pain get worse as well?
It does.
Okay, all right. Now moving your jaw side to side.
Okay.
Do you feel any increase of pain with that?
I just can't even move it to the right.
Yeah.
It's just a constant pain, and I can move it to the left a little bit.
Okay. Before we get any further, I would like to ask you questions about your medical history, if there's anything there that might be. We need to make sure that we're thorough, and that there might be something going on. This could be something that could be contributing. Do you have any allergies or injuries?
Not really.
Okay. Never fallen down in a way that might have? Okay.
No.
Okay. Motor vehicle accidents?
No.
Okay. Any other systemic problems that you're aware of? Heart disease?
No.
Anything run in the family that? Yeah. Okay.
I'm healthy overall.
Okay. You mentioned stress might be a contributor, and it definitely is. How's your personal life currently in terms of job and family?
Things are okay. I'm under a lot of pressure from the university right now, though.
So you work for the university. What do you do?
I'm a professor of kinesiology. I have tenure. I made tenure.
Okay, great. Congratulations.
Thank you.
Well, you're at least aware then of how joints work and what is
I'm very
highly
aware.
likely to be going on there. Yeah. So what I need to do now, what I'd like to do, is to determine exactly why your jaw is being held up, and as you probably know from your training, that this could be a muscle problem or a joint problem, and the uniqueness of the jaw allows us to determine whether it is more muscle or joint. So first what I want to do is I want to palpate your muscles with my fingers, and you let me know if you feel pain, and then I'm going to just stay there for a second or two longer, and you tell me how much the pain is on a scale of 1 to 10, where 10 is the worst pain imaginable. Okay, so we'll start here.
3, like a
About
3.
a 3, both sides or left or right?
No, it's really my right side. I don't think I'm having anything on the other side.
Okay, all right. Here?
Probably 3.
Okay,
Same.
okay,
Same. Less.
okay. And down here?
And that hurts more.
Okay,
I would say like a 6, maybe an 8.
and is it on both sides or just
Just the right.
just the right? Okay.
That hurts.
Uh-huh.
That hurts right
A
there.
lot.
Yeah.
Okay. I'm sorry for doing that.
Yeah.
This is
Yeah.
helping us though with the
Yeah.
diagnosis.
It
Okay.
hurts, but it's less.
And how much would that be?
That's like a 6.
Okay. Just try down here on the neck to make sure that there isn't anything involved
Yeah.
down there.
The right side, that's like a 3.
Okay.
3.
Again. Okay.
Not really.
Okay. And back here.
Like a 3 on the right side.
And okay, so now what I'd like to do is to look at your joint function. So kinesiology is a very interesting subject. What are you working on? Anything currently that books or papers or?
Yes, that's my stress.
That's
I
your
think.
stress. Okay.
I have a deadline.
Another deadline. Oh.
This is slowing me.
Well, hopefully we can do something for you so you can get back to focusing on your job. All right, let me have you bite together and now open as wide as you can. Okay, thank you. And then any further, even if there's a little pain. All right, now close. And to your right side, move as far as you can to the right. And further if possible, even if there's just a little pain. Okay, thank you very much. And to the left. Okay, thank you very much. And forward if you can. Okay, great, thank you. All right, yeah, this does look like it's pretty much in that joint. And the popping and clicking which you've had for an extended time period is a problem with the way the disc in this particular joint works. Sometimes it's not aligned, and you can get the popping and clicking, which resolves the malalignment, but if the malalignment can't be resolved, then you end up getting this kind of a lock. So what I'd like to do now is just attempt to put a little pressure on your teeth, relieve the pressure in the joint to see if we can get that disc back into an appropriate alignment. So let me know if this hurts. I'm not going to push this very hard because we don't want to do any damage. Let me have you just open a little bit. I'll put my fingers in here. Okay, and open a little bit wider. Thank you. Okay. And now you're going to feel a little pressure. And again, let me know if this is too much pressure. Okay, we're definitely getting some more opening. This is very much improved. Okay. Perfect. Okay, so we've done that. I basically did, when you said before that you have manipulated your jaw, you know, this has just gotten to be so severe that you can't do this on your own the way you have learned in the past. But how does that feel now?
I can open my mouth. Yeah, I'm
Great.
sore.
It's a little sore.
Yeah.
It'll definitely be tender for a while. Have you taken aspirin or ibuprofen before?
Yeah, I'm taking.
Does it help?
I think it takes the edge off, but it was really a constant pain. So.
Well, maybe that'll help. Maybe being able to open now will help me resolve it.
Yeah.
I can make a
I think I can eat something now.
great, great. Well, it might happen again. This is because the popping and clicking has been there for some time.
Yeah.
It can come back. So I'm going to make some recommendations so that if you're on your own, I'm sorry,
Okay.
if that happens again, we can make sure that you can manipulate this yourself. I'm going to give you 4 tongue depressors.
Okay.
I'm going to take 4 and I'm going to show you. Let's open these up.
Okay.
I'll show you how to make a little device. It doesn't have to be tongue depressors. You could use pencils, something that's a little bit firm, but won't be so firm that it can damage your teeth.
Okay. Not a spoon.
No, definitely not a spoon. Not something made out of metal. Something made out of wood or even cotton rolls. If you have cotton rolls,
Okay.
could be quite useful.
I can't believe I can talk normally.
Yeah,
I feel like I'm
great.
still talking with my jaw closed. Oh, wow.
Yeah, great.
Yeah, much better. Thank you.
That's wonderful. The
Okay.
reason I like to use tongue depressors is because when you get stuck, it's never quite clear how wide you can get open.
Right.
So with tongue depressors, you can. What we're going to do is we're going to stack them up. And with tongue depressors, you can go with 2, 3, 4, however many as you can actually bite on.
Wedge.
All right. So now what we would do is let me have you use these. Okay. So let me have you put these on your back
Back.
teeth, and I'll help you out. Bite down. That's perfect.
Okay.
Okay, now bite on them, and with your the palm of your hand, let me have you put that on your chin. Push really hard. That'll pop the disc into place.
Oh, I see what you
and then
mean.
you're good. You're probably okay.
think I
This
am.
may be a one-shot deal, but if it does, I'd like to hear from you in the next couple of weeks, just to let me know how.
Okay,
how
do you
things
mean
have
a
been
phone
going.
call or
A phone
come
call,
in?
or come in. You know, you said you're busy right now, and I understand that. So if a phone call is all you can afford, that's
Okay.
great.
Well,
And
thank you.
If I haven't heard from you in 2 weeks, I'll give you a call to
Well,
see how
thank
things
you
are,
for
too.
that follow-up.
And if you do have a problem, then give this a try. And
Okay.
if it doesn't work, come in immediately, because
Okay.
the longer these go, the more difficult they are to manage. And if the cotton rolls work, or if you're having trouble with it, you can come back in and we can, while it's locked, have you do it on yourself, and I can help you to determine exactly how you do the physical manipulation. Now, the other thing we can do to make sure that the joint stays healthy is I would recommend physical therapy, and the physical
Would you?
therapist
Okay.
who you're familiar with, you know, physical therapy, because it's part of your field. They
Yeah.
can help keep the range of motion up, decrease some of that pain symptoms that you're still feeling, and help out that way. And we can then follow you for the course of maybe 6 weeks or so and see if this doesn't completely resolve itself.
That sounds like a good idea. I wouldn't want it to happen again, so I'll try that approach, and I will give you a call, and I appreciate your follow-up with me.
Any other questions or concerns at this point?
Do you think that in the past, when I was able to manipulate it for the good for the moment, it worked, but do you think I did something to injure myself, or because this seems so severe? I just wondered, did I bring it on somehow, or is it a bad idea to try to manipulate your own jaw?
It's not a bad idea at all.
I had success,
it's tough
but
to say why this happens.
okay,
about a third of the population actually does have popping and clicking for reasons we don't understand, but they seem to be without symptoms in the majority. Now you have symptoms, so it's.
This is a different approach with the sticks, though. That's why I wondered if maybe, do you think that that's not such a good idea to be?
Show me exactly what you did before.
I would always, it's sore, but I would always kind of do something like, that hurts.
That hurts.
Or that way. I
Yeah.
just kind of keep working it as best as I could. Obviously, it wasn't locked like cement, or I wouldn't have even been able to move it. This time I couldn't even move it to the right. So I just wondered if I was doing something that maybe caused an unalignment, or...
It looks to me like when you're doing that, you're doing it just using your jaw like this. You're not using your hand.
Pretty much just my jaw.
Just your jaw. So if you're just using your jaw system with the nervous system feedback won't allow you to do any injury. So there's
That's
a
what I
really
thought.
good chance that
You're going to stop before you would hurt yourself.
Yeah, before you hurt yourself. And if you're doing something with your hands, you have to be a little more careful. But by and large, you really can't do anything to harm yourself.
Okay. I'll take some of those.
Okay, definitely.
Popsicle sticks.
We'll give you a year's supply.
Okay, thank you.
Any other questions?
No,
or concerns?
thank you so
Okay,
much.
great. Well, we'll talk to you within the next 2 weeks then.
Thank you so much.
Thank you.
You've been listening to a production of the University of Michigan School of Dentistry. For more information about Michigan dentistry, visit us on the web at www.dent.umich.edu.